Media all ready? Everyone ready? Everyone all set? Okay, good morning, everyone. My name is Lisa Chimera. I'm Deputy County Executive, and I have the great privilege this morning of welcoming you all here. On behalf of Erie County, I want to welcome you today to today's press conference and thank you for joining us for what I believe is an incredibly important moment in our community. Every day in Erie County and in many other communities throughout the country, people experiencing behavioral health emergencies are falling through the cracks of a system that was never truly designed to meet their needs. We are here today because we know something needs to change. 911 call takers in Erie County receive dozens and dozens of calls each day involving someone experiencing a mental health crisis. In 2024, at least 21,000 calls to 911 were coded as mental health related in Erie County. That is almost 60 calls a day. And that number likely undercounts the true volume because mental health is often a hidden factor in emergency situations. Far too often, those 911 calls lead to a police response, an emergency room visit, or worse. We all know that that is not good enough. Today, we are announcing a new initiative that is unprecedented in several regards. It has full support and leadership of the county, commissioners for public safety and mental health, the sheriff, ECMC, and the city of Buffalo. If you take a look at the front of the room, this is unprecedented. Thank you. And also in the room today is a growing coalition of leaders and organizations, including emergency services, behavioral health providers, and advocacy groups, who have been working in close partnership over the past several months to reimagine how we respond to behavioral health crises in our community. Together, we are laying the groundwork for a more coordinated, effective approach using a framework called Call, Respond, Go. We also have the leadership and commitment of the Patrick P. Lee Foundation, whose partnership has been essential in getting us to this point. Their support has enabled us to draw on national experts who have conducted a detailed analysis of our 911 system, the dispatches of first responders, visits to ECMC, and jail admissions. I want to especially recognize Jay McGavro, the Foundation's Executive Director, for her tireless commitment to bringing diverse voices together and keeping the focus where it belongs, on improving outcomes for people and families in crisis. Jane, you have been amazing to work with, and I would like to thank you for everything. I'd also like to extend a special thanks to our Governor Kathy Hochul, for her continued leadership and support in addressing the behavioral health crisis across New York State. She is a true champion for mental health. You'll hear more throughout the morning about the framework behind this work and the progress already underway, but I want to be clear about what this effort is ultimately making sure people experiencing a mental health emergency are connected to the appropriate level of care that best supports their recovery. We are excited about the work ahead, and we're grateful to all the partners who have helped make it possible. I was telling somebody earlier, it's unbelievable, the energy in this room, the partnership, and the outlook for true collaboration and change. Now, I am honored to turn it over to someone who has been a steadfast partner in this effort since day one, Buffalo's Mayor Chris Scanlon.
Deputy County Executive, thank you very much. You know, I attend a lot of ribbon cuttings, groundbreakings, major announcements, things like that. And when I do, I usually start off with, so excited to be here, so honored to be here. Today, I'm just so thankful to be here and to be here in this space. So thankful for these incredible people that have worked on this incredibly important issue. I have all my talking points here, and I was going to go through some stats and all that, but there's people who are more educated in these fields and things like that. They're going to touch on that. I changed my mind. I kind of want to talk a little more anecdotally and a little more personally. Over the course of the past 10 years or so, I've lost 6 people in my life very close to me to mental health issues. 6 people who were parents, children, aunts, uncles, cousins, friends, who didn't quite make it through their battle. People who battled issues for years, some who had things take place in their life that led to certain issues that they couldn't overcome. People who sought help, didn't receive the help that they needed, whether it was a bed not available to them or didn't qualify for certain treatment, whatever it might be. But people who ultimately lost their battle. And I'm so, like I said, I'm so thankful to be here with this group of people who dove in head first on this initiative and brought this to fruition. So again, I can't thank all of you enough for everything that you've done. Deputy County Executive, for approaching me that one day and saying, hey, listen, we have this plan, this idea, and it was such a relief to me. For years, we were talking about trying to bring people in under one umbrella to address this issue, and under your leadership and everyone's leadership up here, it's been able to happen. Jane, I can't thank you enough for corralling all of us on a regular basis and really being a driving force in this initiative. To the sheriff, to Brian Ross, to Tom, to Dr. Hogan, everyone, I can't thank you enough from the bottom of my heart for being a part of this and moving this initiative forward. Because of this collaboration, and it's one thing I talk about most as mayor, is partnerships and collaboration and pulling in the same direction, because that's when I think we're most successful. And through an initiative and a partnership like this, we're going to start to see better outcomes for people who are dealing with certain issues. And so again, I just can't tell you how appreciative I am for that. One of the tremendous partners we have in this initiative is Dr. Michael Hogan. Dr. Hogan's the former New York State Commissioner of Mental Health, one of the nation's foremost experts on behavioral health, someone who has been instrumental to this initiative. And I'd like to welcome Dr. Hogan to the podium at this time.
Thank you, Mayor Scanlon. I'm going to take a cue from you, that having I worked in this space for 40 years, and so obviously there's a commitment that comes with that. But I'm thinking, as I stand with you today, about a different commitment for me, which is personal. A few years ago, my youngest son, who's doing very well now, was out west in a mountain town in a state with good mental health crisis services, allegedly. And he had a serious mental health problem. He was on the main street, half a mile down from the mental health center. It was after 5 o'clock. So I don't need to tell you what, help was not coming from there. So it was 911 that was called. It was officers and an EMT who came. He said later that he was so impressed with how professional and kind the officers were, but what happened to him is he ended up in that part of the system, not in the part of the system where he should have gotten treatment. He was taken to the ED. He was cleared for having medical problems. He was taken to jail and spent 48 hours in a jail cell psychotic until I was able to get out there. So my mission in this is, as the mayor's is, and lots of the rest of us, is personal as well as professional. His experience was not unique because it happens sort of every day here, as you've already heard, and it happens many times every day around the country. It's been the norm for over half a century. 911 has been the go-to number for crises, and somehow it's become, despite the fact that we have alternatives, it's become the go-to number for mental health crises, where, and most of the time, as in my son's case, that response is kind, but it's not a response of care. It's a response of get somebody somewhere to solve the problem. Now, we're here, I think, in part because in 2022, 57 years after the first call was made in 911, the country launched a 988 number, and Crisis Services answers those calls here in Western New York, which was the first time we had a mental health hotline. But as long as it's taken to build a capacity in the 911 system, we've got to build up that capacity in the mental health system as well. It's a good first step, but until and unless we have collaborations like this in communities across the country, it's not going to solve the problem. And I just want to reinforce to you how extraordinary it is to have the elected leadership of the county, of the city, to have the appointed leaders for law enforcement, of the medical center, of behavioral health, who are willing to work together to solve this problem. There is something, I'm not going to say unique, but rare and special that is going on here in Erie County. There are lots of places around the country that are picking off pieces of this. They're opening a crisis center, as you will very soon here in Buffalo. They're trying to figure out how to coordinate better between 911 and 988. But it's really the whole package that has got to come together for this to work. One of the things that's also unusual about this is the commitments that have been made to pick up the covers and look at what the problem is. We all kind of have a sense of what's going on, but we've had data provided by a dozen different agencies throughout Erie County and the city to be able to finally get a comprehensive picture of this, and you see snapshots of this data around the room. And this framework of somebody to call, respond, somebody to come to you if you need help, and go, a place to go if you need more than just a brief contact, is proving useful to help us get a handle on this. So we're checking all the boxes up until now. This gathering together is a great sign that we're beginning to get there, but now it becomes our responsibility to work together to deliver comprehensive approaches that can actually work for people around the country. And so the effort that's been led here by leaders throughout the county, the incredible support of the Lee Foundation and Jane McGavro, is really remarkable. And I, for one, look forward to being able to come back and share what our plan is to make these changes real. And so I want to introduce someone who is in the middle of making this work, and I'm so happy to be able to say this for the first time, your new County Mental Health Commissioner, Sarah Bonk.
Thank you very much, Dr. Hogan, and thank you everybody for being here. It is truly an honor for me, but also the culmination of lots of years of work in a lot of variety of spaces. But today, that work is really representative of how we will be moving forward as a community. And it's an honor to be here as somebody who can reflect back the mental health system, not only from a personal level, but from that professional point of view. And like many families, oh, this is Mike's, my bad. Excuse me, I was relying on that. My apologies, but that's why we have a good team, because we have the Martin Group here to help us and make sure that we were well prepared. So as the newly appointed Commissioner of Mental Health here in Erie County, again, it's an honor for me to be here. But it's important that we also stand firm on introducing the responsibility of what this work means, because it's fundamentally looking to redesign the system as we currently know it and introduce a variety of layers of both accountability, but of options that are available to our community members. We are calling this crisis collaborative, the Crisis to Care Collaborative. Project. This is work that is coordinated from a multi-agency commitment to build on a more responsive, accountable system that provides crisis care. As a newly formed partnership led by Erie County and the City of Buffalo, with deep involvement and active listening from our law enforcement partners and emergency services, crucial engagement from healthcare providers and community members alike, and as well as the people we serve, and then most importantly, the community. That's rooted within this collaborative is centered on the belief that no single entity can fix a fragmented system. We have tried this before and seen that it doesn't work, but it takes that shared responsibility and collaboration that starts today to ensure that we have what we need to provide services to those experiencing crisis. This effort is being powered by the support from the Patrick Lee Foundation, whose early investment and strategic vision helped us bring so many of us together with the shared purpose, and by the Peter and Elizabeth C. Tower Foundation, whose additional support will allow us to expand and, most importantly, accelerate our work. The goal of the Crisis to Care Collaborative is as straightforward as it is urgent: to ensure that the individuals experiencing a behavioral health crisis in Erie County have access to effective stabilization services and coordinated follow-up care. Right now, that does not happen consistently enough. And as Dr. Hogan noted, this is a national crisis, and Erie County is no exception to the experience of that crisis. Every day, we still have police officers, EMTs, and emergency responders acting as the first line of defense, and as a system, we've put them in that position to be the first line of response and oftentimes dealing with those experiencing crisis. The result is individuals experiencing crisis ending up in jail cells, hospital beds, or worse, avoiding what they truly need, which is stabilization, care, and community. Most importantly, to me, what makes this Crisis to Care Collaborative unique is how it's a commitment to system-level reform and change. And that really is a big part of what makes this initiative different, is that leadership from the top down is in alignment with a plan, consensus, and determination about what those steps are moving forward. But this work is complex, and it's going to take time. It's going to take time. And I am not a fan of that. I think anybody in this room who knows you can tell I prefer things to be done yesterday. But I say last for myself, this is going to take time. And with that, the foundation that we are laying here today, the people at the table, the people who have been at the table even prior to today, the data that we are evaluating, the report and support that's being received, the urgency that is felt at all levels of government around this issue, and with tremendous optimism, we are hoping that we will invoke and promote further change. I do also want to thank our partners across the county, the city, every single one of our service providers who are working every day with those clinicians who are doing the most important frontline work and with the peers in our community. But I especially would like to thank the Patrick Lee and Tower Foundations for making this work possible. The value of having an outside perspective, being able to coordinate and herd all of us cats, is really an invaluable asset to this work that also allows for us to build upon the regional focus that the state has also outlined in terms of that regional planning for us as a community. But ultimately, this collaborative is about turning crisis into care and turning that care into permanent change. And so now I'm pleased to introduce someone who's been at the center of this very work from the very beginning, Commissioner Brian Ross. He leads Central Police Services, which oversees Erie County's 911 system and a variety of other emergency response services. Brian brings deep experience and steady leadership to this initiative, and he is going to walk us through some of the core elements of our approach, including the call, respond, go model that's helping us reimagine how we respond to this crisis work. Please help me in joining and welcoming Commissioner Ross.
Thank you, Commissioner Bonk, and thank you all for attending this wonderful occasion. I'm incredibly proud to be here, to be part of this initiative, and to be here speaking to you. So as you have heard today, we're facing a complex, deeply rooted challenge, one that communities throughout the country are struggling with. But here in Erie County, we're not just naming the problem, we're building a solution, a very important solution. At the center of the solution is simple, yet powerful idea. We've chosen to refer to it as the Call, Respond, Go model. Call, Respond, Go is more than a phrase, though. It's a framework for transforming how we handle behavioral health crisis in this community. Let me walk you through this because it is kind of a step-by-step thing. The first piece of the Call, Respond, Go is the call. Currently, when someone in Erie County is experiencing a behavioral health crisis, their way to get help is to call 911. But this system that we currently have isn't quite built for this type of emergency, and call takers have limited options. Their choices are often limited to 24/7 resources like police, fire, and EMS. How do we make sure that our call takers have the technology, training, and resources to know when a call appears to involve someone experiencing a mental health crisis? And that is a challenge because our call takers are simply that. They are, not typically clinicians. So we're trying to make sure we give them what they need to get there. And we need better tools in the moment of crisis to accomplish this. Tools that help dispatchers connect to people in need with appropriate care, not just emergency transport, which is oftentimes the case. That's the first step. The next piece of the Call, Respond, Go model is to respond. This step refers to who shows up. Too often, people in behavioral crisis are met with law enforcement, not because it's the ideal response, but because it's the only one available 24/7. This is not fair to our officers or the people reaching out for help. We're working to identify effective alternatives to traditional lights and sirens response. We're looking at co-responder teams, as well as mobile crisis services as possibilities that show promise to what we're trying to accomplish here. The Go piece of Call, Respond, Go. Right now, a few places in Buffalo provide 24/7 support for individuals experiencing behavioral health crisis. ECMC's Comprehensive Psychiatric Emergency Program, commonly referred to as CPEP, is one of those essential resources, a place where first responders regularly bring people in urgent need of mental health care. But CPEP is an acute care setting meant for the most serious mental health emergencies. It is not designed to effectively treat many of the challenges that people in crisis are facing, however. Yet that's where people end up often by default. In fact, on average, once every 3 hours, an ambulance or a Buffalo police vehicle shows up at ECMC with someone experiencing a mental health emergency. ECMC is working tirelessly to meet this need, but clearly other options are needed. We have to expand existing alternatives to bring new services online so that people can go somewhere safe, effective, and more appropriate for their needs. Best Self, an important partner involved in Crisis to Care initiative, will be opening up Best Response, an intensive crisis stabilization center later this year. This center will serve as a critical resource to provide a new level of urgent care that will serve individuals across their entire lifespan. The Best Response Center will operate 24/7 and provide immediate assessments, counseling, and referrals to further treatment. It will be designed to de-escalate crisis, provide medical assessment, management services, and potentially prevent hospitalization whenever possible. This will be a welcome alternative to CPAP for law enforcement and emergency responders. The Call, Respond, Go model is helping us reimagine a broken system, one that too often criminalizes mental illness. It also exhausts our public safety resources and fails to meet people where they are. This is not a theoretical framework. It is already taking shape, thanks to the leadership of many of the people in this room today. From elected officials to our emergency medical service directors, from the dispatching supervisors to our nonprofit partners, like the Patrick Lee Foundation. One of the other leaders in this, leading the forefront of this work, is someone who's seen consequences of our current system firsthand and who's committed to doing better, is my colleague and our Sheriff, John Garcia. Sheriff Garcia and his agency are on the front lines of this crisis every single day. Under his leadership, They're helping to drive a new approach rooted in compassion, professionalism, and care. So please join me in welcoming my friend, Sheriff John Garcia.
25 years working with Brian at BPD and frustrated at not being able to help people each and every day. You know, I want to echo the sentiments that every other speaker had. I'm thankful, grateful, and blessed to be here today. Good morning. I want to thank Deputy County Executive Lisa Chimera. Everything she does is wonderful. It's an honor being part of the group. It's an honor working with Sarah Bonk that we worked over the years in helping police educate us with the mental health issues. And with the entire Crisis to Care Collaborative for bringing this group together and making this a priority. It's long overdue. As sheriff, I see firsthand how many of the challenges we face in public safety that are directly connected to mental and behavioral health. Last year alone, over 5,000 people came through the doors of the Erie County Holding Center. 1 out of every 4 people in our custody has been diagnosed with serious illness, and 60% of those in our custody are on some form of a psychotropic medication. That is just not a stat. These are real people, real families, in a system that hasn't kept up. For too long, law enforcement has been the default first responder to behavioral health emergencies. Prisons are not mental health institutions. It should never be considered that. While we have invested in training for first responders and law enforcement to increase opportunities for de-escalation and a better understanding of mental health conditions, we are not mental health professionals. That's why this Crisis Care Collaborative is so important. We need more options. We need better coordination. We need a system that meets people where they are. It actually helps them get better. That means better facilities, better staffing, and more tools for our deputies, our dispatchers, and most importantly, our people. Because at the end of the day, that's who this is all about. It's about our people in our community. The families who call 911 because they don't know what else to do. The officers who show up again and again only to see the same person in crisis over and over. We must break that cycle. We must do it together. I'm proud to be part of this effort, and I promise you, my team and I will do everything we can to support this and make it a success. Right now, I want to introduce someone who's been a driving force behind this work and who brings both the urgency and the expertise we need to move forward. I'm happy to welcome my friend, the CEO of ECMC, Tom Kutroch.
First of all, I'd like to thank Sheriff Garcia, not only for his work with law enforcement, his improvements at the holding center, but his commitment to mental health here in our county. It's been a pleasure to work with the sheriff and really a new day in the way that the Erie County Sheriff's Department works. And Mayor Scanlon, I know how passionate you are about this issue. Thank you for all your work. And Deputy County Executive Lisa Chimera has also been corralling us and keeping us in line. And of course, the Lee Foundation. Thank you very much for everything you're doing. Jane's been doing unbelievable work bringing us together. And thank you. I know some of the board members are here. Thank you for your work and volunteerism to keep this initiative and having the vision to put this forward. I'd like to thank our friends at Best Self, our partners who are in this beautiful building today. Thank you for those caregivers that are here on the ground each and every day, taking care of individuals with behavioral health as we do at ECMC. We see the realities of mental health firsthand every single day. We're proud of the Crisis to Care Collaborative because we know better than almost anyone how urgently this work is needed. Commissioner Ross mentioned it earlier, and it's worth repeating. On average, approximately once every 3 hours, someone from Buffalo arrives by ambulance or police car at ECMC for a behavioral health emergency. On a daily average, this is daily, over the past 12 months, ECMC's emergency department clinicians cared for approximately 177 patients and admitted about 19 patients a day, ultimately transferred from CPAP. In addition, on a daily average, ECMC's ED sees 8 trauma activations in addition to the mental health crisis. Our team works tirelessly to meet this need. I'm very proud of them for their selfless work. Many days were overwhelmed. But the truth is, ECMC was never meant to be the only option, and we can't be the only option for crisis. As you've heard, crisis to care is about building something better. It's about making sure that people in crisis are treated in a way that's appropriate for their situation. Work has already begun on a number of progresses in these progress points. Prior to 2020, we had over 13,000 visits to our CPAP, making us often 1 and 2 with Bellevue as the busiest CPAP in New York State. In 2024, we've seen this decline by 23% because of great organizations like Best Self and others who have helped us take care of individuals in Western New York. We've also extended the evening hours for our help center, thank you in part to the Lee Foundation. It's a walk-in urgent care service center for mental health treatment of adults in crisis, and we've been able to extend those hours. But we know there's a long way to go, and as we say, the difference between healthcare and true care, we want to make sure for our residents they get truly cared for in our community. This collaboration means that people do reach out for help for behavioral health crisis. They're met with compassion, coordination, and care. To all the partners who brought us to this point, thank you. And to the people of Erie County, we're going to need you alongside of us. Whether you're raising awareness, supporting a loved one, or simply helping to end the stigma, your voice matters. At ECMC, we're very, very excited for this initiative, and we are all in. Thank you to everyone, and it's now my pleasure to introduce the leader of this collaborative, Jane McGavero from the Lee Foundation, to close out our gathering today. Thank you very much.
Thank you all so much for being here. Thank you, Tom, and everyone for your kind remarks. I would like to just take a moment to recognize a few guests who have joined us. Legislator Dupree, Legislator Jean St. Tard, Bonnie Keene-Lockwood from the Governor's Office, and most importantly, in my heart, all of the working members of the committees. So we've talked a lot about the leadership, which is so amazing and valuable. But where this work started was in these committee meetings and working groups of my behavioral health partners, our nonprofit partners, law enforcement, and many of them are here today. So I just want to recognize all of you for what you've done to get us to this place. So thank you so much. I'd also appreciate Best Self hosting us in this beautiful community space. And to all of you who have joined us here today, we're grateful for your time, your presence. Whether you represent an organization, the media, or you're here as an interested community member, we're so glad you are a part of this moment. On behalf of the Lee Foundation, we are honored to convene and support this incredible group of doers. Together, we are breaking down barriers to access, building new systems of communications, and strengthening care network to better serve Erie County. Before we conclude, I'd like to offer a few notes on what comes next for the Crisis to Care Collaborative. This summer, we will release our initial findings, a first look at the data, including where we are and where the biggest gaps exist. This will help to guide our work going forward. But as important as the data is, it's only part of the picture. Numbers alone don't tell the full story. That's why we'll also be hosting a community input session to hear directly from those with lived experience. Then in the fall, we will present a set of actionable recommendations for how to strengthen Erie County's behavioral crisis response system for the long term. We want this work to be transparent, data-driven, community-centered, and shaped by the voices of those most impacted. If you'd like to follow our progress, and we hope you do, you can sign up to receive updates at crisistocare.org. For the members of media with us today, our speakers will be available for any follow-up questions or interviews you'd like to do. We're happy to talk more. Took a lot of time today, but we're happy to keep going. So thank you again for being here. Thank you for caring about this issue, and thank you for joining us on this journey from crisis to care.